Now down to KZN, where healthcare workers are under severe pressure, but the provincial government says they're getting the COVID-19 situation under control. That's according to some unions as well. They're responding to reports that the province is failing to deal with the impact of COVID-19. Unions are saying, however, that the health department needs to improve its system for admitting patients and allocating beds. Here's my colleague, Tuba Velane.
A province feeling the strain of the pandemic. In the past few weeks, KZN has been experiencing a spike in infections, with fear setting in among patients and healthcare workers alike.
I think now the reality of COVID is starting to hit patients where they now are starting to personally know somebody who has been infected or who has passed away as a result of COVID. So there is that general panic, amongst the patient population. That also then doesn't take away from the fact that we ourselves are part of the community.
The Democratic Nursing Organization of South Africa says the situation within the health system is still manageable. But the union says the provincial health department needs to improve its admissions and beds allocation system.
We think we are doing okay, because when the first wave came in, we established a lot of hospitals that were identified or they were renovated to cater for COVID. Now, the grounds or the field hospitals were also activated. Now, currently, those hospitals are being activated, but on the same vein, we think it's just a systematic problem where you find there's overload of patients.
The provincial government agrees the situation is under control. The health department is currently recommissioning field hospitals to deal with the impact.
We are getting strained, but not that the availability of beds is a major challenge. Availability of beds have been a challenge for private hospitals, but in coordination with the Department of Health, we've been able to ensure that we mitigate that challenge.
The health department says it's coordinating available beds from both public and private hospitals. Tuba Velane, Durban.